I think we can start. Dr. Amir, you will go first. So, Assalamu alaikum, everyone. Thank you for joining. So, this is another YPC session for the personal statement this time, and we have been joined by our esteemed panelists from the AKU Alumni. First of all, we have Dr. Jamshed, who's has been a YPC co-chair and has been very actively involved with the YPC for a long time. And then we have Dr. Noor Khan. She's a clinical associate professor at the University of Pittsburgh. Thank you for joining. And then we have Daniel Ahmad, who's one of the third year residents in Texas. And then we have Gulrez Ahmad, who's the co-chair of our YPC. And then we have Arslan, who's a social media YPC chair as well. And he will be joining us from Illinois. Thank you everyone for joining. And we will start with Dr. Jamshed first.
I think, Assalamu alaikum, everyone. Can we just have Dr. Ahmed start?
Sure.
And then we'll lead into the discussion. He has a presentation for the personal statement.
Perfect.
Okay, so I don't have slides. Hi, everyone. This is Daniel. I'm a third-year resident at the Texas Tech University. The session mainly today is about the personal statement, which unfortunately I think is one of the most tenuous parts of any application, only because I think it's the only part of the application which doesn't have any very set like criteria or guidelines that direct how you're supposed to navigate through it. So this session hopefully will elucidate some parts of that and help you in writing a personal statement that hopefully is adequate for your application. So I'm hoping that most people will have already read the materials that they provided beforehand before the session, but we'll just like quickly go over some parts of it just so that everyone is on the same page. So the personal statement has varying degrees of weightage based on who is reading it, who the program director is, which program you're applying to, and there's no like one size fits all thing about a personal statement. You just sort of need to throw the widest net so you can satisfy most people that are reading your personal statement, and your personal statement should be it should help tell a few things about you. So the first thing a personal statement should help everyone understand is who you are as a person, and um, everything else in your CV, your in your application, such as your CV, your scores, all of that stuff, that sort of already shows who you are as an applicant, because it's going to have your scores, your research, your various observerships, electives, all of that. But it's rarely going to show who you are as an individual. So that's where the personal statement sort of kicks in. The second thing that the personal statement is that before the interview session that you're going to have with your programs, it's a surrogate for how well you're able to communicate as you know, just because as you guys might realize, being a physician, a lot of parts um, deal with communication. So it shows you how well you're able to talk, how well you're able to sort of like how much grasp you have on the language. Other things that the person statement can be used for is that if there's something that you really need the program to know, for example, like a lot of people might have some what we call quote unquote red flags in their application. And a person statement is a very good place where you can sort of answer for those. You can sort of give explanations for those because there's no other place in the application where you're going to be able to get that. So it's a way for you to talk to the program before actually talking to the program. So that's basically the overview of what a person statement is supposed to do. Now, the guide that Moniz shared, and it was also apparently on Facebook, it goes through example-based what you should sort of try to do and what you should not try to do. But I think that would be a bit too much to go for because as Dr. Jamshed said, we want to focus most of the time of this meeting on questions and answers. So this, as she's sharing the screen, so you can sort of go through it and see what everything that we have as a general rule, try to do and try to avoid. So as you can see, there's also examples and stuff. But again, one thing that I would just like to throw as a disclaimer is that there's no perfect personal statement that everyone will like. a lot of times you might show your personal statement to like 2 or 3 people, and all of them will have differing opinions on it. And that is completely okay. What you want your personal statement to do is be an accurate representation of who you are and what values align with you, so that you are able to like present a sort of a summary of yourself to whichever program is going through your application.
Dr. Ahmed, I think it would be, we have time, it would be reasonable to go through these examples that you've created, just a couple of them. So let's just start with example 1. Can everybody see the screen?
Yes.
Let me make it bigger. Okay. All right, let's just
Okay,
start with this
so
one.
And if you can just hide the side panel on the left.
Yes, I'm doing that. Sorry. Okay, better? And I'll close this.
yeah, so what this part of the so this is all of these examples have actually been taken out of actual person statements that people who matched with me from my class were kind enough to share with me. Some of them are from initial draft, some of them are from their final personal statements that they sent to the programs. So the first example over here that Dr. Jamshed is showing is that this is a very common concluding sentence that people use, which is like, I think your program will allow me to be an excellent doctor and hone my skills. I also love the area and think it's an excellent place to settle. Now, this statement can literally be thrown onto any personal statement and it will probably hold true. And so a lot of programs and a lot of people reading this are cognizant of this. They are aware that this is not something that you are sincere about. This is something that you've just thrown on to check a box on the person statement list. So it probably won't be taken very nicely. It might not actively harm you, but it's not going to come off as a sincere thing. So now what if you scroll down a bit, in example 2, this is something that it's the same principle, but it's a bit more personalized. So now obviously if you're applying to 150 programs, you're not able to personalize something for all of them. But for example, like if you have like 5 or 6 programs that you really like and that you really think that you would do well over there, it's not a bad idea to maybe write something personalized for those programs and send those personal statements to them. For example, like this was one of my friends that I think your program, particularly the primary care track, resonates with my future career goals. Additionally, my brothers reside in Chicago and the added family support would be helpful during residency. Now, obviously, this is a program which was in Illinois. And so they sort of threw this in the end to make them, to give like some additional context, because yeah, there's geographical signaling and program signaling and everything. But this is another added layer to the thing that say the program will they might say that, okay, so this person is actually willing to come here. So it's not just an interview we're going to waste. It's someone that's probably going to rank us high. So you're more like, if they go through your personal statement and they come to this part, you can see how that would add an increased attraction for the program to sort of maybe interview you or rank you. So just, being a bit more aware of this stuff would be good. So again, try not to be vague. And if you are going to throw something like this, make sure that we are writing it well. Okay,
I
so
think the
now
word
this
that you're
example,
looking for is probably like personalization, like direct approach
yes.
to that program.
Yes, exactly. So again, one part of the personal statement that you need to really, really focus on is the personal part of it. So it has to be personal, and that's the only way it's going to be useful for you. Otherwise, it's just something that you're sending to the program. They're going to have 15,000 of these, so you need to make sure that yours is at least personal and not just something that everyone has written before you as well. So this one, it's some moments stay with us forever. I was 9 years old when I found out my father had cancer, and I remember how the ground felt like it had given way beneath my feet. Now, this is now more of a what do you call, like a residency personal statement sort of a thing. This is just a general like writing thing, is that you like to start with shorter sentences because they're able to grasp the reader's attention, and then you can sort of give context after it. So it's like some moments stay with us forever, 6 words, you got it. Okay. And then afterwards you can sort of give a bit of context. This is down there, this is like not a poem, but this is You can go through the sentences, 5 words here, 5 more. This is just a thing that I used during writing. It gives you a bit more idea of how you can use the sentence structure, like the length of a sentence, to guide how your reader is reading through a thing. So again, this isn't from any personal statement. This is just something from Gary Provost.
Yeah.
Then
And just to point out, this is things that they teach students here in high school, shorter sentences, fewer words. You can have 3 words, 4 words, whatever makes a sentence. The shorter it is, the better. So this is very important. Okay. So you want to read this one? This is really good, Danya. So if you look at
okay.
the sentence, it's so long. And sometimes when I'm certain the reader is rested, I will engage him with a sentence of considerable length, a sentence that burns with energy and builds with. So there's a lot of statements like this and personal statements that are just keep going on, right? All right, let's go to example 4.
Yeah. So this is from one of my friends who matched neuro. Sorry. Yeah, they matched neuro. So the highlights of my options in high school was accompanying my grandmother, a stroke survivor, to her regular physiotherapy visits. Now, this again, like, point being, it's just there to give context to the rest of your story. So that's one of the things that a personal statement can help you do, is contextualize yourself. Is that if you're applying neuro, and someone who's reading this will understand that, okay, this person probably does care about neuro. They're not just applying to neuro just because they think it's some specialty that they can realistically match in. It's someone who's passionate about doing neuro. And remember that everyone who is ever interviewing you, or who's in a position where they're as a program director of a program, probably cares about that field, because they care enough to be in that field, train in that field, be in academic medicine, and then be in a role such as a program director, which is primarily more of like an educational role. So they're going through all of this stuff. So they do have a certain amount of respect for their own field, and you would do well to emulate that same respect. So, for example, like if you're matching internal medicine, they don't want to feel like you just applied internal medicine because you did not get into surgery. Or similar with family medicine, you don't want a family medicine person to go through personal treatment and think this person didn't want to do family medicine, they're just applying for this as a safety net. So remember, no one wants to be a safety net. So if ever you're applying to some place, you would like to be, you would want it to show that, hey, I actually want to do this. This is not just something that I'm doing just because. It's something that I'm passionate about. So that's what this example sort of shows you, is that this person was able to show that, hey, I care about neuro, so I want to do neuro. And they matched in neuro.
Okay. And all right.
This is one of pediatrics, one of my pediatrics friends, actually an AMG. So they were growing up as one of 30 cousins. I was destined to be a part-time babysitter. Now, pediatrics, I really like this. It's lighter than the ones we've already discussed. It's not like, cancer diagnosis or stroke or physio. It's just, I had a lot of cousins and I deal with a lot of kids. So, not every person's statement needs to be a heavy-handed, like a um, tragedy. It can also be just something that, like this. It's a simple, succinct, tells you what you need to know, that I have experience with kids. So also remember that the tone of the person statement also should be a bit. So like if you start off with a cancer sentence, you don't want to throw another sentence like this in the middle. And if you want to, you should, that's more again of a writing thing, not a person statement thing, is that your tone should be sort of consistent throughout the person statement. And then I would also want Dr. Jamshed to at some point in this thing address how the inundation of AI into our lives has impacted this entire process, if at all, because I'm not at a point in my career where I can give a statement like that. I'm just going to say, I don't like it when people use AI to write the entire person statement. You can use it as sort of like getting a bit of help with it, but not just to write the entire thing and submit it blindly. And a lot of times when people use AI to write stuff, this tonation and all of this stuff, it gets messed up. Okay, this is also one of the introductions. This was a bit more of on the flowery side. So again, the personal statements, again, it's up to you how you want to express yourself. So now, this was actually a personal statement that I really liked, and this was about someone who was applying to internal medicine, and they are sort of like equating their this person is a writer, so they're sort of they go into how they think that internal medicine is sort of writing like a really good sentence, which sounds like a weird thing, but I really like the way that they did this. Is that, you know, they went into it and they were like, okay, so this is how I write a sentence, and you know, it takes a lot of time for me to figure out and put stuff together, which word comes where I need to add a pause, where I need to add a full stop, and you know, that sort of when everything comes together and you have the perfect sentence, that's sort of how they like internal medicine. And as you can see, a lot of people will write, I like internal medicine because it's like a puzzle. So this is the same play on that, but it's in a different way. So I like this. It was a really nice read. These were parts of the introduction part of it. And then we come into example 7, which is basically a lot of times people in their personal statements will include a patient story or like a medical anecdote of some sort. So this, during my medicine clerkship, I cared for a patient hailing from an underserved community who had not been able to seek medical help until her symptoms became unbearable. This was a friend of mine that matched family medicine. So your anecdotes can be very helpful, but all do remember that your anecdotes should be there with purpose. So there's no rule anywhere that says that every person statement must include a patient encounter. If you are including a patient encounter, there should be a reason you're including that patient encounter. Either that shows something about you, about your field, about your interest, about your ability to collaborate with a healthcare team, whatever it's showing, it should be there with purpose. It should not just be there to be like, hey, I saw a patient. This is what I did with the patient. I diagnosed the patient when no one was able to. That should not be the aim of your anecdote. It should be there with purpose. So this was also from another friend that matched neuro. They had a lot of experience in public health. They also did an MPH. So this is sort of how they were able to tie that stuff together. Is that, you know, I want to use my experience in public health to continue work on neurological disease prevention, engage in research, and use the findings to advocate for policies and systems tackling healthcare disparities. Not a flashy sentence. Some might say it's a boring sentence, but it gets the message across. It says, hey, remember that MPH, this is why I have an MPH. So it's able to, again, remember the personal statement is there to contextualize your application. So it sort of gives you that's why the MPH comes in. So this was interesting. Friend match pediatrics. Um, Living in Karachi has been, to say the least, eventful. From going to school among the daily stress of terrorist attacks to the constant power outages, has been quite the journey. My experiences while growing up here have inculcated an element of resilience in me. Um, the the point of these examples is not to, you know, just throw stuff out, but it's supposed to show you that a lot of times people will say one of my best qualities is resilience, or I value my resilience, or some variation of that sentence. This sort of gives you a very good example of how that candidate is saying that this is a thing from my life that shows me that I'm resilient. So again, exemplifying, contextualizing, that's all your personal statement is doing for you. The next one from the example 10, this is from a surgery, friends. The seamless movements of a surgeon's fingers orchestrating every event with meticulous detail is something I've always marveled at. I equate this parts of this field to cricket, a sport that I've played since my childhood. Predicting, analyzing, and timing every small element of the game remains center field. Again, impeccable. I really like how they took something like cricket and equated it to surgery. Again, you just need to understand your field to be able to see what's important in it. I really hope you guys are understanding why we're going through all these examples and going through all of that. This part, so this is the end of the first paragraph, but it taught me an important rate communication. These communication skills will later be sharpened in my medical school. And then the next paragraph was studying the slum areas of Karachi as part of my medical education. I've consistently found myself once again acting as a mediator between the overburdened medical staff and the underserved patients. So again, this sort of shows you how you can connect paragraphs from one paragraph to the other paragraph, because one paragraph ends about the candidate's communication and the next one starts with an example of that communication. So a lot of times you will be able to see that when you're reading a personal statement, your own or some of your friends, whichever, you'll see that a lot of times it's just two paragraphs. It's just one of them ended and the second one started. There's nothing connecting them, nothing doing that. That really breaks the flow of your reading. So when you know how we say you need to capture the reader's attention with the first sentence of the first paragraph, yes, you need to capture it, but you also need to keep the attention. So if you add such a break in between, you sort of risk in losing that attention that you managed to grab in the beginning. So it's very important for your paragraphs to have some semblance of flow in them. The third part of the examples that we're showing is about the conclusions, which is like, the ending of your personal statement. Again, there's no such thing as, so a lot of times you'll hear about the stuff that, okay, paragraph 1 needs to be introduction, who are you? Paragraph 2 needs to be why you did medicine, that's not a thing. So your personal statement needs to go through what you want to tell the program. It can be in any order as long as it makes sense. But the only reason that this was sort of structured this guide into a way that it would be easy for you to understand, but this paragraph thing is not a thing. Okay, so this is the example 12 up there was not that important. It's just a very standard set. We're going to example 13. It says, I'm going to be a great psychiatrist one day and everything else is secondary. The phase is my life. I'm all in on psychiatry. Bit strong, loved it. But again, context. So the theme of this personal statement, I remember, was that he was telling that everyone told them not to apply psychiatry, not to apply psychiatry. So this person statement, in the end, they wanted to double down and be like, no, I'm gonna do psychiatry. I want to do psychiatry. I liked it. It was a very strong end to it, and that it shows the ending of a person statement is a very effective way for you to close together what your entire point was. And what Dr. Jamshed highlighted, as you can see, there's no big word in this. You don't need to bring out a thesaurus every time you're writing a personal statement. All you need to do is to have be able to get the message across. Example 4 is, remember that thing we discussed up there about the stroke and physiotherapy and all of that? This was the ending of that personal statement. So I tied down the conclusion for that. So no matter what trajectory my career in neurology takes, I will always be the child that saw my grandmother recover to the efforts of an excellent neurology team and will strive to do the same for my patients. Again, tied stuff together, very succinct, very able to, tied everything together. That's all I'll say. Yeah, came full circle by the end. So this was a very good personal statement. And then this is basically some of the articles I used to write this guide. And again, they've shared the guide with you guys, so you can go over it in a much more detailed view. And now I'm going to let Dr. Jamshed take the lead.
Thank you, Daniel. Thank you so much. So that was wonderful. And, I asked Daniel, I said, are you sure you want to share this? And he said, it's public information. And I think it's a really good guide. I think we should, if you're okay, Dr. Raza, we should go ahead to the questions because they seem pertinent. And then Dr. Khan and Daniel Ahmed can respond to them along with Dr. Inayat and other people. So I'll let you
Could we give
go
Dr.
through the
Khan a
questions.
few seconds to introduce
Yes,
herself
of
and
course.
see
Of course.
if she has any thoughts before we start taking questions?
Of course.
Yeah, thank you for inviting me, Danielle. First of all, that was a wonderful PDF that you put together. It's going to be so helpful for applicants. Thank you for doing this. I just I don't want to repeat everything you just said, but some of the things that you said that particularly stuck out to me, and some things on which I may have a slightly different perspective. So first of all, command of language, in the world of AI and large language models, we know that any text can be entered into a large language model and turned into a very well-written command of language style thing. So when I'm reading a personal statement, I have very little time. I have 2 or 3 minutes because there's just so many things to read and review, so many applicants to review when you are considering who to invite for an interview. And then when you're interviewing and you're doing your pre-interview prep, there's just not that much time. So it's really easy. I don't know how to describe this, but when you read something that's AI generated majority, it's very easy to tell that this is not the individual's own voice. So don't worry so much about command of language, but do worry about expressing your voice, and it needs to come across what kind of a person we are inviting to interview to our program or inviting to come to our program by ranking them highly. So when I read a personal statement, the question in my mind is this someone I'm going to want to work with? Because my residents are going to be my colleagues. I'm going to depend on them to take care of my patients with me. And I really want to get some understanding of, okay, if this person does come to my residency, it's going to be a joy or a pleasure, or I'm going to learn from them, or there's going to be something they're going to bring to the program. I really like the start of that personal statement that had some humor in it, because the vast majority of personal statements I read have the pathos and the gravity and the heaviness, that it's always it's a nice change to have a more humorous voice comes across, because think about it yourself. You want to be working with someone who has the tenacity and the resilience, but also has the sense of humor to deal with the profession we've chosen. Different people will read your personal statements differently. You're absolutely right about that. There's some personal statements I love and others may not. But what I would advise applicants is I want you to read out your personal statement yourself and record yourself. And then I want you to listen back to yourself and see how you sound. So don't just give it to other people to read. I want you to actually physically, verbally read it out aloud and see how it's flowing. Because if it's not flowing this is a personal statement that you have spent hours and days with. If for you yourself, when you read it, it's coming across as clunky, just imagine how it is for someone who only has a couple of minutes to review this. So write in a way that it flows, write in a way that it's cohesive. Avoid monotony. So it's not just about using short sentences. So I actually like the paragraph you shared from, I'm forgetting the name, I think the last name was Provost, to avoid monotony, avoid cliches, avoid generalization. So your text should flow in a way that it is easy to read, and you should write in a way that it's easy to read. I think I'll stop there.
Sure. Thank you, Dr. Khan. I think, Dr. Jamshid, we can start with the question. So there's a very good question. Is it okay for someone, there should be like some overlap between CV and personal statement?
Anyone can answer.
So
Well, honestly, so for me, there should be no repetition. I already have your CV, and I don't want that repeated in the personal statement. I know that's hard. I think that's one of the questions that I hope that our panelists can answer, that when you're struggling and you just don't know what to write, how to approach it. But ideally, we would like you to not repeat. Now, you can try to explain something in the CV. I think Danielle talked about this. If you want to talk about something that you want to enhance on that's in the CV, that's only a one-liner, but you want to put more context into it, you should explain, you can add that to your personal statement. Maybe it's an experience or something that's really important to you. But just definitely not a repetition. Dr. Ahmed Khan, I think, has his
Yes.
hand raised.
I just wanted to share my few thoughts before I leave because I'm on call. So regarding the questions, I agree with Dr. Jamshed. Yeah, so personal statement should be about you as a person. It should not be filled with what you did in US, or I mean, you could add pieces of it just to show what kind of a person you are, your attributes, but it should not. And that's something we have seen a lot where people just put all their CV stuff. I did that. I graduated from number one medical college. I rotated at number one institute. So I think that doesn't go well with the readers. That's number one. Number two, overall, I'll just give my 2 cents. A personal statement needs to be personal. It has to be about yourself as a person, not necessarily about what you have done, your CV, and it has to make a statement. It sometimes you have to put things that appears attractive in the eyes of a reader because people are they have so many personal statements to read. They usually skim through first paragraph and last paragraph, and those two are the most important part of your personal statement. uh, One thing I would add is if you are, so it's okay to describe your qualities, good attributes to your personality. But if you are describing it, then give an example. For example, if you are saying you have leadership qualities, then give an example. You have led a football team, soccer team, anything like that. If you're saying you are a team player, then also mention what teams you have been part of. So just making a statement without backing up with an example seems hollow, and an experienced reader can see through it. Also, I would avoid writing. Let's say even if you're a graduate of King Edward, which is considered number one at least in terms of merit medical school in Punjab, I would still avoid writing number one medical college in Pakistan, prestigious university, because people know program directors, assistant program directors here in US, they know most of these colleges, so you don't have to. It to me at least, and it's just my personal opinion. To me, it appears like a show off, which doesn't do well for you. These would be my 2 cents. Thanks a lot.
Thank you, Ahmed Rehan. So I think the next question is how much we should talk about our red flags, like year of graduation, something else in our personal statement, like gap between the MBBS and coming now for the match.
Maybe we can direct this to Dr. Khan.
Sure.
Yeah, so your personal statement is the only option that you will have sometimes to explain any red flags. So how much you should talk about it? Of course, first of all, your personal statement should not be very long. It should definitely not be more than one ERAS page, whatever that character or word length ends up being. So you don't want to be using that very important real estate on your personal statement to spend too much time explaining red flags. If it is a significant red flag, and if you can actually tie it into whatever tone, whatever direction your personal statement is taking, that would be honestly ideal. But don't worry too much about over explaining the red flags. You don't want to be apologizing for the red flags either. It's just sort of a explanation. So you want to really get to that right balance of giving your point of view while avoiding over explaining and apologizing.
And I want to give you an example. I'm mentoring a cardiology research fellow. He's an IMG and he's been doing research for 2 years and he did not match last year. And so I told him to write the personal statement and he brought it to me and I read it, and there was nothing about the last year in there at all. Nothing about what he's been doing, why he didn't match, or what not matching, how that impacted him. It was this very generic personal statement. So I said, I want to see the first one, and the one he applied with had a lot more substance to it. The point being that I'm the program director. I know you've been doing research for 2 years. And I want to know what you did. I'm like, what impact did that have on you? And if you're just starting to write with This is why I went to medical school. In the first paragraph, after 2 years of cardiology research, it just is not impactful. I already know you're done medicine, right? So all I'm saying is that someone's asking how to start the first paragraph. Maybe stop thinking of it as an essay or as a person's. Just think of it as who are you or who am I, and just start writing. So that's just another thought.
Sure. Thank you. Thank you, Dr. Jamshed. Then Daniel, do you want to say anything about it?
I agree totally with them, with especially with what Dr. Jamshed said right now, is that a lot of times the personal statements that I get for reviewing, they just start with, oh, so this happened and then I went to medical school. It's like, I don't need to know why you went to medical school. You already did medical school, you graduated, you're applying as a physician. So that part of your life is good for you, but it's done. So if you, like Dr. Khan said, this is very valuable real estate. So using that one page you have on ERAS, which is the only way you have communicating with the programs, on reiterating stuff from your CV or telling them why you went to medical school, seems like a waste of space that you could be using for something much more effectively. That you're not going to get that place anywhere else in the application. So be very mindful of what you are putting in your personal statement, and not take it as just, okay, let me just go over why I went to medical school, where I did my electives, and which research I've done, because that stuff is already there in your CV. So don't waste that very valuable space you have on stuff that you don't need to use it on.
Thank you, Daniel. So next question is, does our statement have to be related to medical field experiences of our life? Or it can be something else as well. If Aslan or Asad, Dr. Asad wants to take this answer question. Asad bhai.
So I think it's okay. I think it's a personal statement. Sometimes I'm intrigued by things that are not in medicine. I think it's perfectly fine. I think you can include personal experiences, and I think that would give, if it's truly real, I think that would give a real personal insight of who you are. I think all of the people who are applying there, medical students or freshly graduated, individuals. So the story about medicine is going to be pretty much the same. Everybody wants to help people. Everybody wants to do the best they can. They want to make an impact in healthcare. But I think if somebody has waited tables, somebody has gone through a personal challenge to go through to get to the United States, and if it's a real story, if they were one in like 12 siblings or something like that, and there was something there that is truly unique and truly can be written well. I think it's important that you don't try to do things, and you err when you try to stand out, and just make sure that you write it well. This actually is well looked at by other people as well. But it's perfectly fine to include non-medical experiences, and to actually as a context allow you to explain how that would make you as a better applicant for their residency program. I think that's very important. You have to be emotionally intelligent about this.
Thank you. So
Oh,
the next, yeah,
I have only ever once seen only one personal statement that had nothing to do with medicine. It was a story. You would have to be an exemplary writer or someone, it would have to be very impactful for you to write that. And honestly, I think we were just interested in wanting to get to know that person more. The rest of the application was great scores, great CV, but personal statement was just a story, and so that was interesting. But that's something that requires a lot of I don't know, guts and maturity, maybe.
That's
One thing I would say is that a personal statement, unfortunately, is not going to save a weak application. But if you already
Yes.
have a strong application, that's when you really have the opportunity to do these things that set you out as someone different, someone that would be an asset to a program, someone, when you read what you've written, we want to get to know you more. And I'm sure Dr. Jamshed's read hundreds of personal statements, but this one is still stuck with her, right? So,
Yeah.
so when it's done right, it can really be a powerful factor for your consideration.
But I have one suggestion on that. Like, not everybody can write really good English. Most of us are primary Urdu speaking people or some other language speaking people who also know English. So I really don't want people to start pushing using AI and other sort of things to come up with Shakespearean English, that will not justify you on your interview day either. Simple words are effective if used properly as well in the right place. And I honestly feel as long as it reflects your true story, it will resonate with people. And you don't need to follow any guides specifically. Most of us, what happens is we ask the seniors to send us their PS, and that's what we start copying and building our personal statement around. And one of the things that I always recommend to everybody is write your first draft yourself without reading anything else, so that when you start reading somebody else's, you can tweak things around, but your general body remains the same. Like it remains personal.
Yes, so Aslan bhai.
So yeah, exactly. I think what everyone said, most of the things have been covered. Like one thing I wanted to know, okay, I always say that there is no wrong person statement. Personal statement is a way of how do you define yourself to other people. So agar, if there's a story that you want to mention that defines you, that is important to you, that is important to you think would be the part of that has shaped your life, I think that should be part of your personal statement. Rather it's medicine, rather it's not medicine. If something has shaped your life to such an extent where you are right now, it should be part of your personal statement. One more big comment I wanted to make is that personal statement, ERA CV, and your personality or your interview all should be in line with everything. So agar if you have CV, you have experiences in your CV, then you have a personal statement of Shakespeare, as everybody is saying, and you have a personality of someone who hardly able to use any good words in English, then it completely confuses the program director. Like this is a different person on paper, this is a different person on CV, and this is a different person on personal statement. So write down whoever you are in personal statement, same in the CV, and when they show up and they meet you, they do not get any surprise out of it.
Thank you, Dr. Khan.
Yeah, just one quick. I think you all may want to consider this is an answer to Dr. Gulrez Ahmed's comment. You may want to think about what language do you think in. If you don't think in English, you think in Urdu, write your first draft in Urdu and just look at it. And then see if you can, do a simple translation into English. I know this, some people may not agree with it, but sometimes it's really hard for people to start writing in English. When I wasn't this fluent in English, I would struggle because to me, all it reminded of was school. And अब आप इस topic पे ऐसे लिखें. But I don't know how to write how do I write an autobiography of a dog? I mean, I'm in Pakistan. I've never had a dog. I have no idea what a dog is. I mean, how do I start writing it? And I'm like in 6th grade. So it's okay if English is not what you're thinking. If you think in Urdu and Pashto and Sindhi, whatever, or in French, maybe write it in that and see if that helps you. This is for people who are struggling. So I think it's not one option. I don't know if people disagree with it, but that's something you can consider.
Yeah, Dr. Khan, you want to go ahead?
Yeah, I just have two quick comments. First of all, what Dr. Aslan said, absolutely. One thing I will tell applicants is don't sweat the personal statement too much. A personal statement, if you are able to, may really elevate your application. However, the main thing that we're really looking for in a personal statement is something that won't sink it. So you really don't want to come across as arrogant. You don't want to come across as someone I don't want to know. And you don't want to have obvious grammar issues in this day and age of, so many different AI editors and also colleagues who may grammatically read your application. That's easy to do. So don't stress out too much about not having the wonderful, beautiful, perfect statement that's going to tug everyone's heartstrings, because it's the main thing that you really do want to avoid doing. So the only wrong thing you can do is to not sound like yourself and to come across as someone who people are not going to want to associate with. And then the second thing that Dr. Jamshed said, so I used to do this all the time, think about something in a different language and then turn it into whatever language I was writing in. For me, it was Urdu. I wasn't that great at Urdu in the beginning when I was in Pakistan. I got better at it by just sort of, thinking, what do I want to say about this? And then just sort of saying it in Urdu. So it's absolutely a great idea and a great tip. And don't feel like you need to have a command of the language to be able to express who you are.
Sure. So just funny comment. So for me, I have to think before in Saraiki and then translate it in Urdu and then go into English. So the next question. So next question for Dr. Jamshed is two questions. So either we should mention about subspecialty, or the other question is either we should mention about like being unmatched last year. So these two questions, I think we can answer together, Dr. Jamshed and Daniel.
So I think you have to know yourself a little bit. So for this mentee that I have, he is really impacted by not matching. I think it was a shock. You've done 2 years of really good cardiology research. You've presented at national meetings, and then you don't match. It was so impactful that I was surprised that it's not in his personal statement, right? Because I knew that he'd gone through. So I think in that case, yes, I would like to see something in the personal statement, but it's not necessary. He was actually scared of talking about it, and so I have to keep encouraging him. For other people, maybe it's not that impactful. Whatever you are going to write about, you have to, I think Daniel actually talked about this. You have to write about what you learned from that experience, how it impacted you personally, how you overcame it, and what you did. It shouldn't be just, you to stop thinking of it as a red flag. I just dislike this word so much. Think of it an event that happened. I mean, things happen to people all the time. I went from Pakistan to Singapore. I had to repeat ninth grade. I came back from Singapore. I had to repeat 11th grade. I'm now 2 years behind. Other people think that's a huge deal. I'm like, whatever. It doesn't matter to me. So stop thinking of events as red flags. Think of them as an experience. And those are experiences that you can share.
Sure. So Daniel, what do you think about mentioning about subspecialty interest?
So again, I think Dr. Khan and Dr. Jamshed are probably better to answer this than I am, but from what I understand, so for example, if you throw a lot of stuff, oh, I want to do cardio, I'm passionate about cardio, or I'm passionate about GI in your personal statement, that can actually deter programs which aren't that cardio heavy or GI heavy
Yeah.
from actually calling you. So there's no need for you to be throwing this stuff in your personal statement for now. Figure on matching into the primary specialty first, and then afterwards you have more time to stress about matching into a subspecialty. But a subspecialty should not be a focus of your personal statement. I think it actually detracts from what you're trying to do. And in addition, as Dr. Jamshed said, most of the questions that are being asked in the chat are mentioned in the document. So whenever you guys are done with the session, try to go through the document also, because a lot of stuff will be answered in there.
Thank you. Asad bhai, do you want to?
Yeah, actually, yeah, I agree. The personal statement is for internal medicine or surgery or whatever. I mean, it's not a personal statement for a subspecialty. I mean, they want to hire you as an internal medicine resident, not as somebody who is going through a longitudinal track to become an XYZ fellow. Just try your best to explain why you would be a great internist or a surgical resident or whatever specialty, or a pathology resident or a psychiatry resident before you want to be something else. I think that's very important. I think that actually makes the other person feel a little bit less as well, that you're using them as a stepping stone rather than something else. I mean, that's as simple as that. So I think, and of course, if you're in a specialty, like if you're a specialist, of course, you want to be a good internal medicine doctor first or a good surgeon first. So I think that still doesn't leave you. So I think it's very important that you don't really focus your personal statement around it. At the end of any statement, the way I look at statements is it revolves around a theme, and then you have to close it out, right? The closing of something is important, the beginning is important, and then the meat of it is important. But I think lastly, when people are finishing a personal statement, they feel obligated to mention something, oh, I want to do something X, Y, and Z. I'm going to leave that a little bit open-ended if you're not entirely sure about it. Some people try to write separate personal statements for different programs. I think it's okay to do that as long as if you rotated in a particular program and you really like something, I mean, that's their specific personal statement. But I think it's okay to have maybe a statement for programs that do not cater towards a particular specialty versus others, but keep things open-ended and focus your attention towards the primary.
Sure. Dr. Khan, do you want to go?
Yeah, just one comment on this. So I am a generalist. I'm a generalist by choice. I always wanted to be in some field of medicine that really focuses on, dealing with as many systems as possible. So yeah, if a subspecialty is something you feel very strongly about, then, and you're including it in your personal statement, you can. But when I'm reading a personal statement, so for someone like me, an audience like me, that's almost not really a negative, but it's almost like, okay, I feel neutral about this because my passion is not rheumatology or it's not cardiology. My passion is being a great physician, training people who are great physicians or great communicators. So just sort of keep that in mind. It depends on who is reading your personal statement. And sometimes overly emphasizing your subspecialty interest may be, what I said before, a waste of real estate for that particular person. So do it if you feel very strongly about it. Do it if that's the cohesive theme that you have for your personal statement. But I would just be careful about that.
Dr. Khan.
So the only time
Um,
I would say that you do need to talk about is if you've done research. So if you've done 2 years of research, let's say in GI, hemo, cardiology, and now you're applying to family medicine, and that happens a lot. You need to explain in your personal statement where that's going, like what your thought process is, what happened. Or if you are doing research and you are, or you may be somebody who is so confident about your skills that with that research experience, with your scores, you're only looking at programs that offer cardiology fellowship. That's a place you can talk about cardiology passion. A lot of people at UT Southwestern here apply because they want to go into cardiology. So I think you have to think about what Dr. Khan also said is what are you applying for and what is your strength. And but if I'm doing a family medicine personal statement and I have a CV of someone who's been doing 2-3 years of research in an internal medicine specialty, I would like to know what that is all about or what the disconnect is. Or you make a case. We had a graduate from Aachen who wanted to do ophthalmology, did all her electives in ophthalmology, then decided after those electives she does not want to do ophthalmology, did some observerships, and she was struggling. She had to make a case of why now she wants to switch to internal medicine. But she made a case. It's like, I know it's a bad example. It's like selling something. You have to sell it. You have to sell your story. It has to make sense. So that's maybe one time you may have to talk about it.
Sure. Arslan bhai.
Yep. I think in line with Dr. Jamshed, as she mentioned, I would definitely want to see personal statement more related to internal medicine. But there is, again, as she mentioned, if your CV is very heavy on one specialty research, for example, cardiology, or one, GI, you have like 2-3 research here and that, and you have like multiple research articles and publications on specifically GI, then your CV almost is telling us about that you are inclined towards more GI. And it's okay to, in that situation, write down a little bit about that you have a little inclination towards GI after completing your internal medicine. So again, if your CV is completely blank, you are a person who has never done research or do not have any inclination of your cardiology, and then you mention about, your aspiration to be a cardiology, it kind of even tells us like, this guy does not have an extra work that needs to become a cardiologist, but it's just, mere words saying that, he wants to be a cardiologist. Then I think then you stick to internal medicine. So if you have past work done in a specific specialty, that might support maybe 1 or 2 lines specific about your specialty in your personal statement, but not a lot.
Thank you. I think we can take the last question. Like, is it okay to mention about the attempt in exams? If Dr. Jamshid or Dr. Khan, anyone can want to take it.
Is it okay to
You go ahead.
switch
Go ahead,
exams?
Dr. Khan.
Yes,
If they've
attempt.
had an exam, they didn't pass and they had to take it again. I think it's okay to put anything in the personal statement, first of all. I think, again, if that's something that you learned from, it impacted you, you want to talk about it. You should put it in your personal statement. I think it would help me if I see that. And I always give an example of my friend, Dr. Khan and I have a common friend. She took her step 1 and she called me after the step. She said, I left the exam. I said, okay. She said, well, I needed to fail it so I could take it again. Because if I didn't fail it, I couldn't take it again. I said, okay. So then she took her step 1 and step 2 again after preparing, realizing that she hadn't prepared first time. And she got, at that time, she got 99 percentile for both. Okay. So clearly smart girl. But when she applied, she needed to explain that. I mean, people were curious. I mean, how do you go from failing to 99 percentile? So in that regard, she explained it in her personal statement a little bit, but she left room enough that when you're interviewing, you can have a conversation. Because when you have a conversation about it, you're a little bit more passionate and you can do that. So it's completely up to you. I think that it's good to explain it. I want to see if you're vulnerable and you learn something from it. Sometimes we think of not passing as again, it's not a red flag if you worked hard and did well at the next one, right? So
Sure.
that's just my take on it.
I agree.
Thank you. I think we as I think up to our time we can take the last comments. We can start with Danielle. Do you have any last comments to summarize?
So again, thank you guys for arranging this session. One thing I would just like to iterate once again to everyone is that your personal statement is personal. It is the only way you have communicating of the program outside of your actual interview day. Use that space wisely. Do not waste it. And go through the guide, the one that we have sent. Most of the questions that I have left unanswered in the chat are already addressed in there. And some people were asking where they can find it. If I'm not wrong, it's on Facebook.
Yes, yes, yes. Aslan, do you have any comments?
Yep. Thank you so much for the session. It's an amazing session and amazing comments. I think one thing that I want to mention in line with Dr. Khan, what she said, there are 3 kinds of person statements. 10%, after reading them, the program director wants to see you, who you are. 10% are the person statements, after reading them, the program director does not want to see you. And then the 80% gives additional information about you. Just don't fall in that 10%. After reading them, the program director does not want to see you. And those are no plot, no story, grammatical mistakes, spelling mistakes, and completely poor written. So if you are in that 90% of that, you're all safe and good. And again, just that don't do these small mistakes, and there's no room for these mistakes right now at this stage. Thank you.
Dr. Khan, do you want to?
I'll just reiterate, I think the most helpful advice that I give to my mentees is read out your personal statement aloud, record it, play it back to yourself so you hear how you sound. When you're asking other people to read it, also ask them to read it out loud so that it flows nicely. You may have excellent material in there, but if it's not flowing, if it's something about the writing is monotonous or difficult to read, too long sentences, etc., I'm going to lose interest very quickly. I'm going to be using too much cognitive effort to really understand what you're trying to say. So you should communicate what you need to without doing it in a difficult, onerous, overly grandiose way.
Dr. Jamshed?
I won't repeat what everyone has said. My only point would be when you're done with your personal treatment, take your name off and put somebody else's name on. And if that person's statement can belong to somebody else, then it's not personal. So try it. Yeah.
Thank you, Dr. Jamshed, and thank you, every panelist. I think we will continue the further sessions on the YPC platform, and we will have mentor-mentee program coming up as well, so the applicants can get their direct help from the mentors as well. Thank you, everyone. Have a
Thank
good.
you.
Thank you, everybody.
Thank you for your
Thank you.